Hello there, my name is Dr. Obi, also known as TheWhizDoc. And in this video, we're going to talk about the thyroid gland, talk about the hormone that's associated with this gland, as well as symptoms associated with low thyroid hormone levels. So let's go. In this video, we're going to talk about the thyroid gland. As you can see, it is a butterfly-shaped gland with two wings on the side and a thin portion in the middle that wraps around the trachea. I would show you a better picture here. Yes, so it's wrapped around the trachea, which is also known as the windpipe, and you have a thin portion in the middle and two winged sides. And this organ actually produces what we call the thyroid hormones that are responsible for multiple functions in the body, including metabolism. So if you have a dysfunction of this gland, it can affect a lot of processes in your body and also cause low energy level. What is hypothyroidism? Hypothyroidism occurs when you have low levels of thyroid hormone production. And you have two major types. You have primary hypothyroidism, you have secondary hypothyroidism. With primary hypothyroidism, there's a dysfunction within the gland, which is the thyroid gland itself, while in secondary hypothyroidism, there is a dysfunction higher up, be it in the hypothalamus or the pituitary gland in the brain. And in primary hypothyroidism, you have low T4 and you have high TSH. And also in secondary, you have low T4, which is pretty much hypothyroidism because there's a low production of the thyroid hormone. So if you find yourself with a low T4 and normal or slightly low TSH or slightly high TSH levels, then you worry about secondary hypothyroidism. Hypothyroidism is actually very common in the US and also in other parts of the world, in developing countries, developed countries. You find that studies have been done in the past that have shown that the prevalence of overt hypothyroidism is 0.1 to 2%. It might sound like a small percentage, but when you look at the bigger picture, which is the actual number of people in the world, and you realize that 2% of people in the world might have hypothyroidism, that is a large number, and that's why it is important to understand what this condition is. Subclinical hypothyroidism, like I said earlier, is actually, yes, less symptomatic in most cases, but is actually more common in individuals. You have about 4 to 10% prevalence around the world. And the United States National Health and Nutrition Examination Survey had some study done, or a survey done, involving about 13,000 individuals that had no history of thyroid disease, no family history of thyroid disease, and they tested their TSH levels, their T4 levels, checked their antibodies to thyroglobulin, checked their TPO antibodies, which is a thyroid peroxidase antibodies, and the results showed that about 4.6% of them were actually hypothyroid. And out of that 4.6, 0.3 were overt, so like they had like primary or secondary hypothyroidism, and more of them, which is like 4.3%, had subclinical hypothyroidism. And studies have also shown that women are at a higher risk of coming down with or getting diagnosed with hypothyroidism compared to men, about 5 to 8 times more common in females than males. And it's more common in females that have a small body size since birth and also during childhood. So now, for the symptoms that are associated with hypothyroidism, we have issues involving your skin and your hair. As you can see, look at this skin. This skin is very dry and very scaly. What happens in this situation is that because of hypothyroidism, there is decreased blood flow to the skin, and that can cause it to be very dry, very scaly. You can have decreased secretion from the glands in your skin such that you find yourself not sweating as much as you normally would. And just as a characteristic feel to it, characteristic look to it, where it's very dry and rough. You actually have non-pitting edema, so you have like generalized swelling, fluid, going into your tissues. Usually this is seen in very severe cases. It's not as common as the other symptoms, but it's seen in severe cases of hypothyroidism. Another part of the body that we actually look at when it comes to hypothyroidism are the eyes. So usually when you have this protrusion where the eyes are like, you have like a stare, you have periorbital edema, or when you have like protein complexes infiltrating the area around the eye, and that causes the swelling around the eye. Usually it's generalized non-pitting edema around the eye. And people that tend to have these symptoms are those that already had Graves' hyperthyroidism and they already got treated for it and then they became hypothyroid. Another symptom or sign is anemia. So you find people with hypothyroidism also to be anemic. In most cases, it's normocytic, so normal red blood cells. But in some cases, some people actually have what we call macrocytic anemia. But the more common form of anemia associated with hypothyroidism is normocytic normochromic anemia. And if you have iron deficiency anemia, especially in females that have heavy periods and bleed a lot, they could actually have iron deficiency anemia associated with hypothyroidism. And in this situation, it has been shown that when you give just iron replacement, sometimes does not work as well. But it has been shown that when you give both the levothyroxine, which is the thyroid hormone replacement medication, and iron replacement, not at the same time because it can interfere, you give them at different times, it has been shown to actually have significant improvement regarding the iron levels and their anemia. So another organ that is affected is the heart. We know that the thyroid hormone is responsible for metabolism, for energy levels. So pretty much the heart is not going to pump as well as it should. In hypothyroidism, it has decreased contractility, the rate decreases. So your heart is pretty much not functioning as much as, or as well as it can function if you're hypothyroid. And in this situation, if your heart is not functioning as well, then you cannot really work out the way you want to work out. You go to the gym, you find yourself really tired, unable to push yourself as much as you feel like you can at the gym. You get short of breath very easily. You have like heart failure-like symptoms. Also, it has been shown to be associated with hypertension, increased lipid levels or cholesterol levels, and also some effusion in some cases around the heart. So regarding the lungs, very similar to what happens with the heart. Also, the same thing happens with the lungs. So the lungs are unable to really expand the way they are. Also, you find out that they have decreased exercise capacity because of weakness of the muscle. And some people actually have what we call macroglossia, which is like an enlarged tongue. It can be a very swollen tongue. And usually when you fall asleep, you can have sleep apnea where you stop breathing for a bit, or a blockage of your airway because of the large size of the tongue. Also, one of the organ systems that is actually really affected by hypothyroidism is your GI tract or your gastrointestinal tract. One of the most common symptoms is constipation. Very, very common to have constipation in individuals that are hypothyroid. This is because, just like we said, your heart is not contracting as well, your lungs are not expanding and contracting as well. The same thing happens with your gut muscles. They are not really contracting as well as they should, and that can cause decreased motility. Things don't move through your gut as fast as they should. They stay in there and you get really constipated. You find yourself also having reduced taste. You have atrophy of your stomach, and in the process of having atrophy of your stomach, it can cause what we call pernicious anemia involving the intrinsic factor and B12. Also, you have cases of celiac disease, non-alcoholic fatty liver disease, and also modest weight gain. And also in respect to reproduction and fertility, you have problems with your periods, with your menstrual cycles. You have like no periods, you have irregular menstrual cycles, you can have no bleeding, you can have a lot of bleeding. When your menstrual cycle is abnormal or it fluctuates, then that can affect fertility. And also, if for some reason you get pregnant, there's a higher risk of early abortion or miscarriage in individuals with hypothyroidism. Women are not the only ones affected. With males, you can have issues with respect to your libido, erectile dysfunction, and delayed ejaculation. Involving your brains, you have poor concentration, slow mentation, and it can cause depressed moods. And also you have carpal tunnel syndrome, where you have an infiltration of the carpal tunnel in your wrist, and that causes a compression of the median nerve and can cause numbness and tingling in your hand alongside or along the distribution of the median nerve. You can have polyneuropathy, you can have muscle weakness and pain. Like I said, muscle weakness, you get cramps, you get muscle pain, you get joint pains, you get aches, you get stiffness, and you're at a high risk of gout if you have hypothyroidism. So these are some of the symptoms that are associated with the condition hypothyroidism, and it's important that we understand the symptoms such that if we have any of these symptoms, we can go talk to our doctor, our healthcare provider, or nurse, figure out if it is by getting the blood work done, and if for some reason it is, they can get some more tests to confirm the reason for you being hypothyroid. And once they get that done, they can start you on the appropriate therapy to get you feeling better. And finally, we've come to the end of this video. It is important to note that with hypothyroidism, if you have been diagnosed with this medical condition, just know that it is something that can be treated. So with hypothyroidism, there are therapies out there that can be implemented to help you live a very productive life and a fulfilling life. So if you have these symptoms, do not hesitate to talk to your doctor and get the treatment that you need. In this video, we talked about the thyroid gland, talked about the various kinds of hypothyroidism, talked about the prevalence of hypothyroidism, and we also talked about some of the symptoms associated with hypothyroidism. If you learned from this video, do not hesitate to hit the like button, subscribe to this channel, and hit the notification bell for future videos. Thank you for watching up until this point, and I really appreciate you. Hope you have a great day, and do not forget to hit any of the links to watch any of the other videos in this series. Thank you. Have a great day. I'm TheWhizDoc. Bye.